Hi, this is Dr. Pamela Jones with PetCure Oncology, and I'm doing an imaging review for Darwin Winterhalter. A previous consultation was performed for this patient on video on June 3rd, and the CT images I'm reviewing are from a previous one that was done on May 15th and one that was done recently on June 5th. Just to orient you to a CT scan is a collection of x-rays to form a three-dimensional image. In most patients, and in Darwin's case, we imaged him from the tip of the nose towards the tail, and we did cross sections of those images, or what I like to call breadloaf slicing, and we turned those images on end. So just to orient you to the image on the left, in cross section, the bones are white, the other soft tissues are various shades of gray, and air is black. So this is the endotracheal tube in his larynx, this is his skull, this is his brain centrally, and all the other tissues are salivary glands, muscle, and brain tissue. So I'll show you the one thing that has not changed at all on his scan. Again, the left side is May 15th, is this meningioma that was an incidental finding, and that's this bright area centrally within his brain, that bright little marble that's right there. And that has not changed between the scans that were previously done. It may look a little different because these slice thicknesses are 2 millimeter on the left, and we do them for radiation planning. We tend to do 1 millimeter. So every time I move the little contrast, I'm moving twice as many slices. But just to get in the general area, this is that on the right-hand side on June 5th. This is that central area, that bright area. And again, very much unchanged, just a little ball sitting right there, and it measures the same as what it did last time. So now what I'm going to move is I'm going to move up towards the head, and I'm going to actually put both of these images pretty close to about the same place. In his body, there's a little bit of difference between them, but I've got them as close as I can. And again, part of that is because of the difference in image slice number. But hopefully they'll move together and we'll get close enough. So again, this is a cross section. I want to look on the right-hand side because that's what's important. It's what's most recent. It's current. This is the eye on the right-hand side. This is the eye on the left-hand side. Up here on the top is his top of his head, and this is his chin down here on the bottom of the screen. This is the bone of his jaw. This is the oral cavity with that endotracheal tube in his tongue. So right here centrally, if we move forward a little bit, this is actually, this butterfly shape is actually his brain centrally, and this is the bone that surrounds the brain that's between the nasal cavity and the brain cavity. So I want to point out a couple of changes. It's evident on both the pre and the scans from today, but this is fluid in the frontal sinus. We will treat that as potential tumor tissue if we, moving forward with radiation therapy. And this is fluid and or mass in what's called the retropharyngeal area. So we're back beyond the mouth, kind of where the nasal, post-nasal drip would occur, is right in that area. So I'm going to move forward into the nasal cavity now, and what I notice most on both the May 15th on the left as well as the June 5th on the right is all this tissue in the nasal cavity. This left side is normal open airway. It's air. It should be air up in there in the back part of the nasal area. But this is all abnormal lymphoma tissue in there. As we move forward, again, we just have this extensive amount of tissue in here, including the retropharyngeal area as well as the nasal area with normal on the left side. Now, what I do notice very quickly as we move forward, and again, we're off a little bit, but I do notice that we are seeing some more swelling out here, more swelling beneath the eye. This is the eye, and so this is into the orbit. Normally there's a thin bone here that the tumors will erode through, and again, that's very similar to what we're seeing in him. So again, just a little bit more tissue up in that nasal area. The other big thing that we're seeing as a difference is, look at the left side again. The left side of his face, I'm sure, was quite normal at the time he was done May 15th. This is normal skin over the top tissue of his nose, even though this airway is occluded, and on the left side it looks normal. If we look over here to the right-hand side of your screen and the one that was taken on June 5th, we have a lot of tissue out here between the skin and the bone of the nose, and so I'm sure he is having significant swelling on the right side of his face. And again, the inside of the nasal cavity is pretty much unchanged. It was already pretty well affected. As we move forward, I start to see some destruction of the top of the nose bone, on top of that maxilla. That's not unusual with nasal tumors. And again, I see this soft tissue out here where previously we didn't see that on him. So he's got some progression of the lymphoma. That's disappointing from the standpoint. It even goes clear down into his nostril right here on that right side. You may even see that the nose is being pushed off to the side, where if we go back over to the pre-scan, we saw a little bit there, but there was definitely no distortion of his nose, and we're seeing changes. Just to cover again, cats are pretty resilient to side effects of the hair and everything on the outside. So although he'll get dose out here, I would anticipate we would have hair loss. We may have mild inflammation, but usually cats will get a little bit of scale around there. When it comes to what eye would be in the radiation field, the left eye is probably going to be protected. The right eye and optic nerve. The optic nerve is actually back here a little further where it runs down and runs into the brain. So we may be able to be away from that optic nerve and optic chiasm, but the eye itself will try and do the best we can to keep the dose away from there, but it will get a little bit of dose. I imagine we have a small risk of getting some conjunctivitis or inflammation around the eye immediately following radiation therapy. But otherwise, we should be able to spare the oral cavity and be able to adequately treat the nasal tissue with minimal to no side effects. The brain is close in some areas, and remember we talked about inflammation of the brain. He's on steroids, so I think his risk of acute inflammation of the brain is low. I think he does have a small risk, albeit not as high as 20% as brain tumors do, of what we call demyelinization, like I mentioned. That risk is 2 to 4 months down the road, and again, his risk is probably 5%. It's probably not that high. And long-term side effects such as necrosis is probably less than, we say less than 5% in any normal tissue. With the dose we have to give lymphoma, it's probably only about a risk of 1 to 3% at the most. And that risk wouldn't be till a year down the road. When we talk about the same thing within the brain, I also want to reiterate the risks there are the acute inflammation, which he's on steroid for, the acute inflammation and swelling that can happen in there, as well as the demyelinization risks, as well as the necrosis down the road. And again, I think all of his risks are going to be similar. Prognosis for both of these tumors with stereotactic radiation therapy is about 18 to 24 months, just kind of on average for cats. I always tell people if you read all the articles on nasal lymphoma plus or minus chemotherapy, it's somewhere 500 plus days to over 3 years. So but if I look at all the averages for nasal lymphoma, it's probably 18 to 24 months. And with meningiomas, I'd say it's probably 18 to 24 months too with stereotactic radiation therapy. The biggest thing is he has a good prognosis as far as both of those to having a response. They're both considered radio-responsive tumors. So I anticipate that he would have a good response to both those protocols. We would probably try and do a single dose. However, if we're including in the same radiation plan, we probably have to do a 3-dose protocol only because the meningioma limits that. His head is small enough that we could probably put them all in one single-dose 3-fraction protocol. So if you have any questions after receiving this imaging review, please let the folks at PetCure Oncology know, and they can get those questions answered for you, or they can put in a request for a treatment plan and we can get them started. Thank you. And again, this is Dr. Pamela Jones with PetCure Oncology.